Hey, this is Marty Stempniak, Senior Writer for Hospitals and Health Networks magazine. Looking to bring about change in a rapid fashion, Southwest Health Center in Platteville, Wisconsin has moved away from the mindset that mission and vision are solely the responsibility of leadership. The hospital has built a structure to engage employees, which has helped bring about impressive operational results for the organization. Today, I'm joined by Dan Rohrbach, Chief Executive of Southwest Health. Dan, thanks for being with me today.
Thanks for having me, Marty.
Could you just start, Dan, by telling us a little about Southwest Health and the market that it serves?
Southwest Health is a critical access hospital in southwestern Wisconsin. We employ about 500 employees. We have about 30 employed physicians and medical staff, and we serve about 25,000 people in our primary service area.
And as I said, employee engagement has been a key ingredient of your success. Could you tell us a little about that and what exactly the Voice is?
The Voice is our employee team that is really in charge of the voice of our employees and how they help run the organization, really, to be honest with you, how they run the organization. My leadership style is very hands-off. I set the direction, serve more as my background is really in teaching and coaching, so really serve more as a coach. To lead the team to where I think they need to go and give them the tools to do that. But engagement is everything. You get those employees engaged and they will take your organization to places you never thought it could go.
And I mean, I've heard you say this stuff isn't rocket science, right? This is something any of your peers could try. I mean,
that's right. Right. I'm not a rocket scientist by any stretch of the imagination, but what I'm good at is developing relationships with staff and getting them aligned to where the organization is going and needs to go, and really convincing them that maybe we need to go to this place, even though maybe it's a little uncomfortable, or maybe we're already pretty good at what we do, but we want to be better and we want to be great. And why is that important? So it's not really rocket science. There's some tools and tactics to get people engaged and feel there's ownership. I think the most engaging thing is when people look at the organization as theirs. Not I work at Southwest Health, but I'm part of Southwest Health.
And you mentioned relationships. So talk about why relationships are kind of the linchpin or the key to this.
Well, I think when you start any job, relationships are probably the key to build the trust, because once you have that, then people will follow you. And relationships also are what you lean on when things get a little hairy. You know, when the weather isn't quite what you want it to be and you're going through some tough times, you can always lean back on, we have a personal connection or a personal relationship, and that usually will carry you through maybe some tense times that if you didn't have the relationship, it would fall apart.
And could you tell us a little about the successes you've seen and the fruit this has borne? Yeah,
so the first couple of years at Southwest, it was kind of just getting the structure, the framework, the team put together, and kind of, if you want an analogy of coaching and teams, it's really kind of preparing for the game. And once the game started now, the last 30 months, we've grown by over 60%. We've grown from 2 employed practitioners to 30. We had 395 employees when I started. We have over 500 now. Our net revenue has gone up significantly. And really every facet of how you measure success in a healthcare organization, we've improved significantly. And we still have a ways to go. I mean, we still have lots of opportunities and things that we want to do and things that we can accomplish yet, but we're sitting in a pretty good spot right now.
How do you feel when you hear someone say that you hope that we can accomplish this?
I love the word hope. Hope is not a strategy. And I tell my staff that all the time. I tell my board that every once in a while. I hear, well, let's make this change and we'll hope it makes a difference. Well, hope is not a strategy. I have twins that are in freshman in high school. They both play basketball. I hope I shoot the ball better next year is not an option. It's shooting 1,000 shots a day for the next 6 months during the off season. That's what makes it happen. It's practice, it's work, it's hard work. So hope is never a good strategy.
Dan, thanks so much for being with me today.
Thank you. Appreciate it.
For HNHN, this has been Marty Stempniak. Thanks for watching.